Yes.
Hello everyone, I am Dr. Priyank Patel and I am a consultant spine surgeon based out of in the city of Bombay and a part of the VR Spine, which is an integrated spine practice group. Of all the different doctors of VR Spine, I look into spine tumors, minimally invasive spine surgeries and sports related spine injuries. Uh, Today, I would like to talk to all of you a little bit about the new thing that is out there, the concept of minimally invasive spine surgery. Now, what happens is a lot of times patients come to us and they ask us that doctor, can you do a MIS surgery for us? Can you do an endoscopic surgery for us? Well, let me tell you, this is a very bad approach because the decision here is not surgery, minimally invasive spine surgery, or endoscopic spine surgery. The decision is number one, does the patient require surgery or not? Once the decision comes that yes, the patient requires surgery, then you start talking about different types of spine surgery. A big misconception in people is that minimally invasive spine surgery means stitchless spine surgery, where there is no cut or where lasers are used. Let me tell you, there is no surgery in spine where you can do it without cutting open the body, or where you can use laser from outside and magically do something without opening up the spine. Minimally invasive spine surgery basically means getting the best desired optimal outcome in a patient by doing the least possible alteration in the body. That is minimally invasive spine surgery. So, a surgery with a 5-inch incision can very well be minimally invasive spine surgery, whereas a surgery with a 3-inch incision could very well mean it is an open spine surgery. So let me elaborate a little bit on that. Now, if you look at this entirely is your spine. All right. Now, in this spine, what happens is there are multiple different levels. Spine surgery is almost always done because with time, what happens is degenerative processes take in, there is wear and tear, and that causes pinching of the nerves. When there is pinching of the nerves, you want to relieve the pinching, right? Imagine if you have pinching at 1, 2, 3, 4, 5 different levels, okay? Then logically, you need to release the nerves at all the 5 different levels. Now, this can be done by opening up the spine this much, or opening up the spine this much, or opening up the spine this much. All right. The idea of minimally invasive spine surgery is identify the area which definitely requires surgery, just open up the spine that much, use magnifications like microscope, endoscope, and release the nerve. So traditionally, we used to open up the entire spine so that we were able to see, and then we used to relieve the nerve. Now, with the help of microscopes and endoscope, we don't really need to open up the entire spine for doing a small job. We can do it very well by just opening up minimally and releasing the nerve. The other concept of minimally invasive spine surgery is don't damage the spine, don't alter the spine, don't put in a lot of implants. Try to release the nerve and let the other part be dealt with naturally with the help of exercises. So truly, this is what minimally invasive spine surgery is. Unfortunately, in today's day and era, it has been propagated in such a way that small incision is minimally invasive spine surgery. But think about it. You want to relieve nerves at 5 level. Okay. If you just to take a 1 millimeter incision or a 1 centimeter incision, you will not be able to address that 5 levels. So the main thing why you have actually taken up surgery, you are not getting the desired outcome. So in that particular situation, it is a wrong procedure and eventually it will land up with poor result. So one question that comes to me is, who qualifies for minimally invasive spine surgery? Well, there is no age barrier for minimally invasive spine surgery. It is more like how long do you want the surgery to last? So let's say if it is a young person who can take in general anesthesia, and it is okay if we are keeping the patient under general anesthesia for 4 or 5 hours, they are totally fine for minimally invasive spine surgery. But if I have to operate on a 90-year-old gentleman where the anesthetist tell me that you have to get this patient out of general anesthesia within an hour, then you cannot do minimally invasive spine surgery, because in that the preparation itself is going to take an hour. So there you go for the classical open surgery and get the patient out of anesthesia as soon as possible. So let your doctor decide if you qualify for a minimally invasive spine surgery or not. Never go with the mindset that this is what I want to do. Is it true that minimally invasive spine surgery is safer than open spine surgery? Absolutely not. It is a big myth. Again, I am telling you that surgery is safe if it is done in the right way for the right indication. If a patient requires an open spine surgery and you force a minimally invasive spine surgery in that patient, then you can end up doing more harm than good. So as far as safety is concerned, the safety of minimally invasive spine surgery and open spine surgery is exactly the same. And this has been proven beyond doubt by various scientific research all around the world. So very important question that comes to us is how fast is the recovery after a spine surgery, after a minimally invasive spine surgery? Well, typically when we do a minimally invasive spine surgery, the patient gets admitted one day prior to the surgery in the evening or in the morning of the surgery. We usually perform the surgeries in the morning hours. Post surgery, it takes around 5 to 6 hours for them to completely come out of general anesthesia. Once they are completely out of anesthesia, we get them walking. So that same day they start walking. The next day they walk the wards. The day after they climb stairs and they are fit to go home. 10th day after surgery, the stitches come out. As soon as the stitches are out, they are free to start walking out of the house, getting back to their normal routine activities. Anywhere between 3 to 6 weeks, people who are working start working from home or going to office. People who are homemakers can start doing little kitchen chores during the after 3 weeks, and between 3 to 6 weeks they get back to full household activities. There are few restrictions which are there up to 3 months, like not bending forward, not sitting on the floor. Although if that time comes, it is okay to do that, but if you can, then we tell them not to do it. Post 3 months, there are really no restrictions. You can get back to basic sports as early as 3 to 6 months. You can get back to contact sports as early as 6 months to 1 year. Basic sports are things like table tennis, where you are not moving around a lot, whereas contact sports are those high impact sports like kabaddi, football, where there's a chance that someone will impact you and you can fall. At the end of 1 year, you are fit to do any and everything. There is no real restrictions for long term. So typically, this is how a person should recovers after a spine surgery. Well, what I would like to tell you all is, although I'm a surgeon, if you can solve a particular problem with the help of good rehabilitation, avoiding surgery, that's the best thing to do. All right. Yes, you will have to commit that you have to do exercises, and it's not for 1 day, 1 month, 1 year. It is exercises for life. Like if someone commits to wearing glasses for weak eyes, they have to wear it throughout life. They cannot complain that I want to remove it on Saturdays. So you have to do exercises throughout life. Let's say if that time comes where you are not getting benefited by exercises and surgery is inevitable, then it is better to do it sooner than later, because when it's inevitable, you have to do it. The more you wait, you're going to increase the complexity of a procedure, and something that can be easily solved within hours will become a complicated issue. uh, when that time comes for surgery, please let your surgeon decide which is the best procedure for you, rather than you deciding the procedure yourself and going to the surgeon. If you follow these things, nothing can go wrong in your life.